Still on AIDS, as the world continues to recover from multiple global disruptions from pandemics to conflicts and shrinking health budgets, experts say the HIV response stands at a defining moment. The 2025 World AIDS Day therefore challenges the global community to examine how innovation, human rights, science and community leadership are shaping the next frontier of the AIDS response. In this report, Basi Itaipang looks at how recent scientific breakthroughs are giving hope for future HIV cure strategies.
From long-acting therapies to gene-editing cure explorations, scientific innovation continues to push boundaries. Researchers are advancing functional cure strategies, but experts insist these breakthroughs must move beyond the laboratory and reach the people who need them most.
So, in terms of the prevention, PrEP, we are rolling out officially in Nigeria January 1, 2026. But in terms of preparation, we have done a lot of preparation in terms of rolling out in the first 8 states.
Despite major progress, gaps in prevention persist. Thus, the Minister of State Health says is unacceptable.
I am proud to report that Nigeria has recorded significant achievements across the HIV continuum, especially in ensuring access to life-saving ART, including pediatric formulations for children.
Over the past few years, Nigeria, like the rest of the world, has faced unprecedented disruptions, a global pandemic, economic uncertainty, fluctuating donor support, and shift in the global health financing landscape. These disruptions are real, they have implications, but they did not break us.
Other speakers say there is a renewed push for scientists to work hand in hand with policymakers and communities, shaping trial designs and using real-time data to strengthen health services. As Nigeria joins the rest of the world to rethink, rebuild, and rise to overcome destruction, experts say the time is now to transform AIDS response if the world must end HIV and AIDS by 2030. Basi Itaipang, NTA News.
Thank you, Basi. And to continue the conversation on this year's World AIDS Day, we have in the studio the Program Manager of West African Center for Public Health and Development, Dr. Chukwu Ebuka Ejekam. Thank you for joining us on the News on NTA International.
Thank you for having me. Thank you.
All right. Now, let's begin with the breakthroughs. What are the new scientific breakthroughs that give the most hope for future HIV cure strategies?
Yeah, over the decades, we've made significant gained mileages with regards to HIV prevention. The newest kid on the board is the potential that we are seeing around long-acting injectables, for example, that gives hope for HIV prevention, especially to those at risk and then the vulnerable. In this instance, talking about mothers, because mother-to-child transmission is one of the areas that, as a country, we are still facing challenges in. And if we could arrest that by the use of long-acting injectables that are giving us hope, innovation in technology and science, if we can leverage on that, there are hopes that by 2030, as a country, we will join the global community in celebrating the elimination of HIV/AIDS. It's doable. We've made significant stride. We've gained mileages, but we are not resting on our oars. You know, there was a time HIV used to be like a death sentence in the initial onset of the pandemic across the globe. But thank God for efficacious and safe antiretrovirals for people who are living with HIV. And then for those at risk, PrEP is a potential. And along the line of PrEP, what the world is witnessing now, innovation from pharmaceutical companies along the line of long-acting injectables. For example, the lenacapavir that has potential twice a year, just injectable, not like everyday regular pill that people used to take, that comes with its own challenges, twice a year, and then people who are at risk can be prevented. And once we are able to prevent the transmission of HIV/AIDS, I think we can begin to shout Eureka by 2030 as a country and as a people.
All right.
We will say goodbye to HIV.
Yeah, we've made so much progress from what you've said. But how close are we to a simplified treatment model for all populations in the fight against HIV/AIDS?
Well, I would say where the gap is, across the general population, mother-to-child transmission, there might be challenges here and there. But I think where the challenges are is within the key population subgroup, because they continue to act as reservoirs of infection. We did the 2020 IBBSX, the West Africa Center for Public Health and Development, on behalf of the government of Nigeria, working with the National Agency for the Control of AIDS and, of course, the National AIDS, HCI and Viral Hepatitis Control Program, NASCAP. We did that, and we found out that the key population are still a population that we need to prioritize in order for us to bridge the gap in prevention, bridge the gap in service access, so that we'll be able, as a country, carry all populations along and ensure a holistic and comprehensive elimination of the virus by 2030. So for me, even though we've gained strides across all other subpopulations, we need to prioritize on key population, especially in terms of equitable access to care, prevention, and care services.
All right. On a final note, what can African and Latin American countries do to contribute more to global HIV research, being that research is key to achieving and improving on the progress that has been made?
For me, I would say leadership, and I will try to unbundle that. We thank God for our country. I mean, when we had the disruption, in any case, for this year's World AIDS Day, the team is overcoming the disruptions, transforming the HIV response. As a country, when we had this disruption early this year, the federal government came in handy, and they were able to provide some kind of succor, especially for people who were on treatment. The money that was provided, like the First Lady had mentioned in the event we had earlier this morning, about 200 million USD was able to cushion the effect for people who are on drugs and all of those things. But not just for HIV, it also trickled down to malaria, tuberculosis. But what we need to do as a country, Africa and South America, is to show leadership, to lead in innovative researches, to own it. Instead of relying on the global north to do this, we will partner with them. Partnership is key, because in this new narrative, innovation and partnership is key for us to achieving elimination. But we need to step up and own it. Local content, local production of essential commodities, including antiretrovirals and other prevention commodities, including the test kit. Thank God for what the Minister of Health is doing. We hope that in the days ahead, we'll begin to see the systemic effect of all this, so that as a country, we can eliminate HIV by 2030. It's doable. And all hearts must be on deck to achieve that.
Thank you so much, Dr. Ejekam, for sharing your thoughts on the fight against HIV/AIDS and what needs to be done to achieve much more than we have achieved at the moment. We thank you so much.
Thank you. Well, I'm an epidemiologist, not a doctor. Thank you.
You're watching the news on NT International. Time now to take a break. More stories when we return. Do stay tuned.